Our changes are at lots of different levels actually, because first of all the test that we're doing is different because we're testing for HPV for the first time. The way that the tests are undertaken are now quicker, so that will result in undertaking more tests within the same period of time, and the results of the tests are also quicker. The turnaround time will be an average of between 4 and 5 days, so it means that results will come back quicker for patients. So all in all, I think a very significant improvement and a meaningful one as well.
Now, what will testing for HPV do exactly when it comes to catching cervical cancer?
Previously, the previous test would look at cells, and it would highlight the fact of abnormal cells, and that would then trigger another test. Now, this test from the outset will tell the clinicians whether there are positive HPV cells or not. So it means that in the case of a positive situation, it means that everything is triggered much quicker and the ball starts rolling much quicker.
So you catch it earlier, essentially?
Yes.
So even though there's some big changes within this screening system, not much will change for women coming for their appointments, will it? Tell us a bit about that.
Every woman will receive an invitation for an appointment as from the age of 25, and then they will have recurrent appointments every 3 years. So the most important thing is that people take up the opportunity of the invitation and attend their smear tests.
So it's not different to the current system in place in terms of how appointments will work, correct?
At the moment, the appointments are the same, but because going forward it's likely that the way that the test is undertaken will be quicker, then we'll see how it goes because it's only started this week. But what the clinicians tell me is that they may be able to offer more appointments a day.
Now, you've highlighted that this new screening system will take a preventative over cure approach, something you've highlighted as a manifesto commitment. Are there any other areas you're looking to improve by taking a more preventative approach in?
Like with everything, the emphasis is always, as you say, prevention is better than cure. And a lot of the emphasis on our services is about early intervention, whether it's about cancer awareness or any other disease that may be available. Our promotion will be on early detection, a lot of self-awareness. We intend to run a lot of awareness campaigns so that people understand the importance of attending their screening programs or attending checkups or other early intervention that we can have in other fields of medicine.
And how are you hoping to improve that with this screening? Do you have a figure in mind?
We don't know yet. It will depend on the level of testing as it progresses, because we need to balance the offering of the service and doing it properly. But if we can offer more appointments a day, then that will be even better.
Now, more broadly, obviously, COVID has interrupted a lot of things about healthcare. How has it affected being able to do smear tests? Have they still been going on whilst everything has been happening? Has it been stopped? What's the situation on that?
There was a short period during the lockdown period where routine screening tests were not undertaken, but I understand that the backlog that may have accumulated from that has now been met. And there is no issue with anyone attending the primary care centre, and our routine screening has been in place for a while now.
Now, the majority of women will go for smear tests for a long period in their life, starting at the age of 25. Tell us a bit about why these ages are important and at what points they might be more susceptible to cervical cancers.
They start the programme at 25 because they believe there's about 80% of us will come into contact with HPV virus in our lives. But under the age of 25, they tend to be able to clear it quicker. So as from 25, we start the programme, and we start every 3 years until the age of 50, which then goes to 5 yearly. But I believe that because of HPV being able to detect the virus, in the future we'll probably be doing less cervical screening because we won't need to do as much.